Hello. Thank you everyone for attending. Today's program is brought to you by Inspira's Spirit of Women program, where we try to educate our community in a fun and innovative way. And we have a great program in store. We're using the Zoom platform today, so we encourage you to ask questions throughout the event using the Q&A button that's on your screen. Your questions will only be visible to us, so feel free to ask whatever you'd like and be comfortable to ask whatever's on your mind. Throughout the presentation, you'll see poll questions pop up on your screen. All of your responses will be anonymous, and we encourage you to participate. It's what makes this fun. This presentation is being recorded, and an on-demand version will be available to you. So let's get started. It's my real privilege to introduce today's speaker, Tracy McCormick. She received her bachelor's degree in physical therapy from the University of Delaware, her master's degree from Temple University in orthopedic physical therapy, and her doctoral degree from Acadia University. She has worked with Inspira Health for many years and specializes in pelvic floor physical therapy to treat pelvic floor conditions for both men and women, as well as many other conditions for which a physical therapist can help. Hello, Tracy, and thank you for participating and helping to educate our audience and debunking those myths related to pelvic floor issues.
Hi, thank you for having me.
Very good. If you're here with us today, it's an assumption that you either know somebody or yourself are having problems with urinary incontinence, or you just like to understand more about the issue. So we're going to help you today to have some more education around that. Our program today is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you might have regarding a medical condition. So we'll start today with a poll question. Really want to see where we are in terms of knowing whether this is true or false. So urinary incontinence is a common reason why women are admitted to nursing homes. True or false? Urinary incontinence is a common reason why women are admitted to nursing homes. Let's see what you think. We'll give you a second to answer. And then here are the responses. 57% of you think that is true, that women are admitted to nursing homes for the reason of urinary incontinence, and about 43% of you think that that's false. So Tracy, why don't you help educate us and tell us whether or not that is true, and really kind of what is urinary incontinence?
Okay, well, thank you for having me, and thank you for all that are listening today to learn about urinary incontinence and things that you can do to improve your condition. So you'll see the first slide talks about the statistics that urinary incontinence is a very common condition that involves the involuntary loss of urine or the loss of bladder control. It's very common. It affects 34 million American women and an estimated 200 million women worldwide. And over 50% of women will experience urinary incontinence sometime in their lifetime. So the last bullet point shows that unfortunately, urinary incontinence is a common reason why women are admitted into nursing homes. Some studies show it's the #1 reason, the #1, and then some studies show it's #2, secondary to dementia. But to me, that's a sad statistic because I think it's a condition that's treatable even at any age.
Yeah, I agree with you. That's sad. So tell us then, what does cause urinary incontinence?
So there are many different causes. So this is a slide that just goes over some of them. So sometimes it's a problem with the urinary system. So it could be weakness or damage to the pelvic floor muscles. It could be due to an overactive bladder. It could be to nerve damage, maybe a UTI or catheter use. But there are other medical reasons that could cause urinary incontinence, and they are neurologic. They could include a stroke, brain injury, multiple sclerosis, Parkinson's, dementia, and nerve damage. Medications can also have side effects, and it can be hormonal. So that's why it's important to see your physician to get a good medical workup to make sure there's nothing more serious. So these are the factors that are associated with urinary incontinence. So age, so it is true, as you get older, it can become more common. Obesity, because of the weight on the bladder and the pelvic floor. Diabetes, current major depression, smoking. Constipation is actually a very important reason sometimes why people can have urinary incontinence because if the feces is in the rectum and the rectum is enlarged, it can press on the bladder and irritate the bladder. History of a hysterectomy, pregnancy, and childbirth, and that would include both vaginal and C-section deliveries. Anything that involves chronic coughing, such as asthma, bronchitis, smoking. When you cough, you increase the pressure in your abdominal area a lot, and it presses down on your bladder and your pelvic floor. Any high-level activities such as CrossFit, where you're doing repetitive heavy lifting, if you're not breathing properly or protecting your pelvic floor, you can cause incontinence. It can be hormonal. Sometimes abdominal incisions and scars can restrict the mobility of the bladder and make it less able to fill easily. Radiation to the pelvic area due to cancer can also contribute to the loss of mobility of the pelvic floor and impair the pelvic floor muscle function. And it can also be orthopedic, a fall onto the buttocks or a back injury. And another one that's not on this list is poor posture. If you're standing with poor posture, the bladder is no longer supported by your pelvic, bony pelvis, and sometimes that can contribute to urinary incontinence.
So are there different types of urinary incontinence, and can you explain to us what they are?
There are many types of urinary incontinence. The three that we're going to talk about today are the more common. It's stress urinary incontinence, urge urinary incontinence, and a mixture of for the urinary incontinence. So the first one is stress incontinence. So this is the involuntary leakage of urine that occurs with activities that will increase the pressure in your abdominal area onto the bladder, and it will overpower the strength of the pelvic floor muscles. So these are the people that say, I leak urine when I cough, sneeze, laugh, when I move from sit to stand, when I get out of bed, if I'm lifting, jumping, running, or any type of exercise. So the cause is either weakness of the pelvic floor muscles, or the activity is increasing the pressure in the abdominal area, putting too much pressure down on the pelvic floor. The next one is urge incontinence. So this is different. It's the involuntary leakage of urine that occurs either with or shortly after someone has an intense urge to urinate. So, and the amount that you lose can vary from a small amount to a large amount. It's also associated with urinary frequency, which is going to the bathroom too often, and nocturia, which is urinating at night. So common triggers for this urgency and urge incontinence would be a key in the door. You get home and you put the key in the door, and all of a sudden your bladder knows that you're home. Sometimes the bladder is smart enough if you pull into your driveway or even just turn down the road to your home. It could be running water, walking to the bathroom, or even near the bathroom at home. Cold weather, anxiety, and mental stress and worry also can contribute and be triggers for the urgency or the urge incontinence. So the cause of the urgency and the urinary incontinence is because it's overactivity of the bladder, and it's also called the detrusor muscle. And then the third type that we're going to talk about is mixed urinary incontinence. And this is the most common because it's a combination of both symptoms. So you could have pelvic floor muscle weakness and the overactive bladder's symptoms with urgency, frequency, and nocturia.
So we hear a lot about the pelvic floor muscles. I know I've heard about exercise to help those very specific muscles. The challenge for all of us, I know, is how often to do them, how to do them correctly. Can you help us understand that concept?
Okay, so first I want to talk about the process of urination. So the process of urination is a complex interaction between the brain, the bladder, and the pelvic floor muscles. Just because it happens so easily most times, people don't realize it is a complex interaction. So this is a bladder. I don't know if you can see, this is a bladder, and the urethra is the tube that comes underneath. So what happens is the kidneys make urine 24/7, sending urine down the ureters into the bladder, and the bladder fills. As the bladder is stretching out, the bladder gets that sensation and will send a signal to the brain that you have urge. The first urge sensation you have is only about a little bit more than a half a cup of urine. But the body and the brain should be able to delay the urination until the person is able to get to the toilet. So the bladder should stay relaxed and continue to store urine. Once the person sits on the toilet, the pelvic floor muscles relax, then it establishes a reflex to the bladder contracts to empty the urine, and then the urine flows out of the body. And when you're done urinating, then the pelvic floor muscles again will contract. So the next slide shows some information about the pelvic floor muscles. So they're a group of muscles in the pelvic girdle. They attach to the pubic bone in the front. This is the front of your body. I'm going to turn the pelvis around. This is the sacrum, the lower part of your spine, and this is the tailbone. The pelvic floor muscles, and I'm going to turn this around. They're the muscles at the bottom of this bony pelvis. So they have 3 different layers. They have different functions. Number one, they are there when they're strong and healthy. They support your pelvic organs, your bladder, your uterus, your vagina, your rectum. They also have circular fibers in the opening. So this is the anus, the vagina, and the opening for the urethra. They have sphincter muscles that are circular, and their function is to prevent loss of urine and stool. These muscles are also important for sexual function. And another important function is this is the bottom of your core. So these muscles need to be strong for your core stability. So that when these muscles are strong and coordinated, someone should be able to have good urinary function and control.
So let's hear about those myths that we advertise for. So can you help us debunk some of the myths that we often hear?
Yeah, so hopefully these are myths that you've heard, and so hopefully we'll be able to educate you on why they're not true. So the first one is urinary incontinence is normal and is an inevitable part of aging. So this isn't true. So urinary incontinence is common and it's tolerated by women, but it's never normal. So it's not normal during pregnancy, childbirth, exercise, menopause, and it's not normal because there are options to improve your urinary function and control. The important thing to know in a physical therapy program, there's not a cure overnight. So it's not urinary incontinence and pelvic floor problems and an overactive bladder may have taken a long time to develop. So it's not anything that will change quickly. So you have to be patient with a program if you start something. The second one is only elderly people experience urinary incontinence. So I have some statistics there for it affects women across our lifespan. So this myth is not true. So although it does increase as you get older, women at all ages have different reasons why they may experience it. So in young women, it's common after pregnancy and childbirth. It can be common in young women because sometimes by doing heavy lifting exercise programs, it can cause incontinence and pelvic floor muscle weakness. If you go on YouTube, you'll see videos of women that do CrossFit in competitions and they are leaking urine and they kind of think it's a successful part of the program, but it's never normal. Urinary incontinence can also be caused by hormonal changes during pregnancy, breastfeeding, and then also too, as you get older, menopause and sometimes surgical removal of the ovaries. An interesting fact too, people think just women that have had babies have incontinence, and I treat a lot of women and teenagers who have never given birth can have urinary incontinence.
So let's ask our audience another poll question. We often hear about if you just drink less, that'll work. I know sometimes if I'm going on a trip, when I go to see my sister, which is a 6-hour trip, I say, oh, don't drink coffee in the morning so that I won't have that urgency or trouble. So let's ask, true or false? If you drink less fluid, you will not experience urinary incontinence. Let's see what you all think. And then we will have Tracy tell us. So false,
Okay,
87% feel that this is false.
I'm glad to see that percentage. So oftentimes when patients come to me, that's what they'll tell me. My strategy for improving my urinary incontinence is drinking less fluid. So the example that you talked about, Lori, one, if you're going on a trip and you want to limit your fluid intake, not a big deal. But it's when people do it on a regular basis. So how it affects you is when you drink less fluid, it makes your urine more concentrated, and that concentrated urine can irritate the bladder. And also the damaging part of it, if you have concentrated urine, it can contribute to bacterial growth and UTIs. So 2 suggestions from this slide would be drink a sufficient amount of water. Typically the recommendation is 6 to 8 glasses of water a day, but then also to avoid bladder irritants. So in the next couple of slides, I'm going to just talk about some things that are bladder irritants. So the first group are bladder irritants that irritate the bladder to most people. So my recommendation is eliminate or severely reduce. So it's anything with caffeine, coffee, tea, sodas, any kind of alcohol, carbonated drinks, diet sodas because of the artificial sweeteners, chocolate, and smoking. The bottom part is bladder irritants to some people. See, it doesn't happen to everyone. You have to see how these things affect you in your urinary symptoms. So, and it's both food and drink, spicy food and drink, citrus food and drink, tomato-based products, dairy products. So if you had, say, for example, ice cream, and then you notice you had increased urgency and frequency, then you have to say to yourself, perhaps that is irritating my bladder. Okay, and the next slide is just water is the best. So the recommendation for the drinking the water, though, is you don't want to gulp the water quickly because that would overload the bladder. It's good to sip it throughout the day. And the other advice is to avoid urinating so frequently at night is to avoid fluid intake 2 hours before you go to bed. Normal urination at night, if you're younger than 65, normal is 0 times. Over 65, it's considered normal to have 1 time a night. So the other fluids that aren't irritating to the bladder are apple juice, grape juice, prune juice, cranberry juice, but you have to be careful. Sometimes cranberry juice can be irritating to some people.
So we often see lots of commercials, right, about how women can help combat urinary incontinence with products. Should we just wear a pad?
So I don't believe this is true. Pads are a common way that people manage your urinary incontinence. And if you watch TV, there's a lot of advertisement showing people being active and, you know, being able to use the pads, but I don't think it's a solution. And it's also costly. What's important though, if you do use an incontinence pad, make sure that you use one that is made for urine. Don't substitute a menstrual pad because those are not as good to pull the urine away from your skin and your skin can get irritated. Okay, so you'll see this slide here that shows 59% of women use pads or different products, 38% do pelvic floor exercises, 16% limit their fluid intake, and 15% modify their wardrobe, like wearing black clothes and things like that. So, you know, hopefully the second one, doing the pelvic floor physical therapy, those numbers would be hopefully more popular as people become more educated about the things they can do for their health.
So we hear a lot about Kegel exercises, right? And whether or not those work or don't work and what we should do. So tell us about those.
Okay, so oftentimes when patients come to me, they say, I've done Kegel exercises for a long time and they don't help. So what's important about Kegel exercises is that oftentimes people are not doing them properly. So sometimes they're squeezing the wrong muscles. Sometimes they're actually straining, holding their breath and bearing down, which is the opposite of what we're trying to get. So it's actually could be worsening their pelvic floor muscle strength. They could be squeezing other muscles, thinking that they're squeezing their pelvic floor. So maybe they're pulling their belly in, squeezing their buttock or their back. They might be doing an improper technique. The pelvic floor muscles are shaped like a hammock. When contracted properly, they squeeze and they lift. So you need to get both to get good function of the pelvic floor muscles. Perhaps they're not performing enough per day. When you come for therapy, we talk about how many you should do a day, and it's a lot. These are very small muscles, and they take a lot of repetition to build up strength. Also, too, not holding the contraction long enough. All muscles have slow twitch and fast twitch fibers, and there's different strategies for exercising both. So oftentimes people will do a squeeze and relax, but you also need to learn to do some where you hold it for a set amount of time. And the other part of the exercise that people often don't do is the relaxation part. Muscles need to contract, they need to relax and rest. So you just can't contract. Muscles need both motion. And the other thing is sometimes I tell patients on the first day, it usually takes about 8 to 10 weeks to see a consistent pelvic floor strengthening exercises to build up strength and to see benefit. And sometimes people get frustrated and they'll give up before then. So this is just a slide that I feel women of all ages should be doing pelvic floor exercises their whole life. So I'm glad when I get someone in their 20s because I can educate them about the things they should be looking at on their pelvic floor to help them have better urinary control as they get older. So it has a lot of benefits for supporting your organs. It's important for sexual and core stability, and maintenance is important, that you have to keep on doing it. Okay, so this is an important slide about pelvic floor physical therapy. It's more than just Kegels. So when people come here and they think it's just about Kegels, it's not. we do, and when it's also not just about doing biofeedback. Sometimes patients will go to offices and they just are on biofeedback, they watch a computer, but that is not sufficient for managing urinary incontinence. So sometimes it's not weakness of the pelvic floor muscles. So that's where a PT evaluation is important for trying to find out what the driver of the problem is. If you have pelvic floor pain, pelvic floor strengthening exercises may not be right for you. So we do a lot of education and try to figure out what that particular person's problems are. So from a PT evaluation standpoint, we talk about urinary, bowel, sexual health. I want to know about your medical history, gynecologic, any abdominal scars. The important part of this slide is the best way for me to evaluate the pelvic floor is with a glove finger with lubricant, and I insert it into the vagina, and then we go through different contractions, and that's how I best know if you're contracting the muscles. Sometimes patients come in and say, no, I don't want that, and that's okay. But the analogy I give them is, say you want me to evaluate your shoulder. So you have a heavy coat on and you don't want me to touch you, but I'll just talk you through exercises. I can't tell you if you're doing the exercise properly. So sometimes I can evaluate it by palpating you from the outside, but it's not the best way to evaluate the muscles. Okay. And this just talks about the pelvic floor physical therapy treatment. So it's not just about Kegels. We give you strategies for managing urgency, frequency. We do manual techniques. If you have problems, orthopedic problems, we help you manage all that. Okay, so the next myth is sometimes people will come in and say, I do my Kegel while I urinate. And this is a common myth because it's written a lot in women's magazines. So it's okay to do this stop test where you contract your pelvic floor to see if you can stop the flow of urine, but not more than one time a week to see if the pelvic floor muscles are getting stronger. Oftentimes I have people that this is when they exercise, but when you urinate, we want the pelvic floor muscles to relax so the bladder can contract. If you start squeezing the muscles, the bladder gets confused and doesn't know how to function, and people can develop urinary problems as a result of this. The other thing about urinating, oftentimes people hover while they urinate. When you hover, your pelvic floor muscles can't relax, and so your bladder can't empty completely. So if you're a chronic hoverer, my recommendation is I think you need to sit on the toilet, put toilet paper or whatever you need to put down, let your pelvic floor muscles relax, let the urine come out.
So one of the other things, I know my grandmother was famous for this, right? She always urinated just in case. That way she didn't have to go later. She thought that helped, and then she wasn't going to leak. So let's ask our audience if in fact they believe that urinating just in case is a good way to help manage urinary incontinence. And again, we'll give you a second to answer that and see if my grandmother is right. And I do have to admit, I went right before the seminar just in case. Let's see. We'll give you another second. And then the results are 50-50 pretty much.
Yes,
so let's find out.
Okay, so urinating just in case occasionally is okay, but it's when it becomes your habit throughout the day. So what happens when you urinate on a regular or frequent basis? Well, let me just tell you, normal bladder health, you should be able to hold 1.5 to 2 cups of urine. So that is holding your urine for 3 to 4 hours if you're having sufficient water intake. So if you have your bladder, the first urge is at about a little over than half a cup. That first urge is just telling you that your bladder is starting to get a little full. But if you listen to that first urge and you go to the bathroom and you listen to that urge on a regular basis, the bladder now learns that this is the new normal. And so then if you try to ignore that, now the bladder is going to send you a stronger urge. It becomes like a tyrant or a boss that's trying to tell you, because you've retrained it to think that this lower amount of urine is the new normal. So we, in pelvic floor physical therapy, we talk about things to how to retrain your bladder and how to have better bladder and toileting habits. Okay, so this one with the myth, my bladder is small and that's why I urinate a lot. This is not true. It's not necessarily the size of the bladder. but it's sometimes your bladder habits that you've gone too often, but it's the interaction between your brain, your bladder, and your pelvic floor muscles that urinating just in case is not a good habit.
So you talked about some of the extreme exercising, and many people say that it's just because of the strain, right, that they experience urinary incontinence. And you even mentioned that people think it's a good sign. So
Yes.
tell us a little bit more about that.
So it is not normal. And my concern is that I know a lot of people do this exercise, and there are safe ways to exercise, but repetitive heavy lifting puts pressure on the bladder. It can cause the incontinence. It can weaken pelvic floor muscles, and it could cause pelvic organ prolapse, where the organs can start to descend down. What's important when you exercise, it's important to protect your pelvic floor by contracting those muscles and also exhaling while you are doing the exertion. So myth number 10 kind of summarizes everything. That oftentimes I hear people say, nothing can be done to treat it. I've had a bunch of kids. This is just the way it is. I have to learn to live with it. And I'm telling you, this one is not true. It is pelvic floor physical therapy can be a successful non-surgical treatment as a first-line treatment. So just remember that pelvic floor PT is not just Kegels. It involves a lot of education and also trying to find out what your particular drivers are that could be causing your incontinence. So this last slide, it's time to take control. Don't be embarrassed by urinary incontinence, and pads are not a solution. It's important that you are the boss of your life. The bladder should not be the boss or the tyrant or the one telling you what you should do, where you can go, or limit your social activities. And I think it's important to live life to the fullest without the embarrassment or to me, what's sad are the social limitations of urinary incontinence.
Yeah, I agree. And I have to say that I'll have to come see you because my bladder is in control. So let's thank you very much. We're very informative presentation. We do have a couple of questions and we'll get to those. So what are the pros and cons of the InterStim procedure and what is the success rate?
Yeah, so I just talked about the physical therapy component. Mm-hmm. InterStim is a device that doctors use to help with urgency. It can be very successful. They'll do a trial where they put it on the outside first. It goes into the nerves in front of the sacrum, this lower part of your spine. And the stimulation, that's the same level that the bladder's irritated. And then if it's successful, then they'll do a permanent one where they can implant it. Sometimes when patients, so there's some cons about it because when you have a device in, then you can't get an MRI. There's different reasons like that. So sometimes we use TENS. So the same TENS device that people use for pain, that we can do trials where there's placements around the ankle or around the back that someone can try to see if it helps people. Oftentimes that's our option for people that have Parkinson's, and it can be helpful.
Is there anything that can be done to increase or stretch the bladder capacity?
So the bladder retraining. So an example I'll give, say someone comes to me and they say, I urinate every 30 minutes. And they're going to tell me they urinate every time they go. And no doubt, because the kidney is always making urine, always putting urine in the bladder. But then what happens is the bladder learns that 30 minutes is the new normal for emptying. So what we do is we try to figure out how often the person's going, and we keep a bladder log that has the food, the drinks that you eat, when you have incontinence, how often you're urinating. And then what we give you suggestions for trying to delay the urge. So then our strategy is at 30 minutes, when you get these urge, you're going to do these things to help decrease the urge, to try to hold it for 2 hours and 5 minutes, 2 hours and 10 minutes, 2 hours and 15 minutes, all day long until that becomes easy. Then you try to tack on more time. And that's a way over time, the bladder becomes used to holding more urine.
And a couple of the questions I know you answered in your presentation. So one of them, you had said that anybody at any age can do physical therapy, whether they're 20 or 80. So you did answer that. And then another one, you had mentioned the key in the door. So somebody asked, why, if I held my bladder for hours while I'm out, can I not hold it when I get to my house and I have to race to get in? And
So when you have urge incontinence, the bladder is overactive. And so when it'll be harder to control your urine when the bladder's fuller. So that's true. But the bladder knows when you're near a toilet. It'll know when you're putting the key in the door. It knows when you're driving up your driveway. And so our strategies are wherever the trigger happens. So you get to your door, and when you start to put the key in the door, we give you suggestions for decreasing the urge so that you can control the bladder. The number one thing you don't want to do is rush with your legs crossed to try to run to the bathroom, because you'll never outrace your bladder. The bladder will, and that's when people lose urine, when they try to run to the bladder when they're having urgency, because the bladder is contracting. And then when you start moving quickly and running, the pelvic floor muscle won't be able to control it.
Right. Somebody asked if they had a vertical scar from a C-section, was that the cause of their urgency? And if so, could you resolve it?
It can, yep. So any abdominal scar can contribute to urinary problems. So that's one of the things that we look at. And so after someone has a C-section, they can do massage to that area to improve the mobility, because those tissues, the abdominal muscles, and we call it fascia. Fascia is like the saran wrap that covers muscles. It's continuous with the muscles of the pelvic floor and bladder. So think of your body like a stocking. If I pull up here, will it have effect at the lower part of the shirt? Yes, it will. So we look at all scars, even old scars, people that have old appendectomy scars or laparoscopic scars, people that have scars from belly button rings, they can all contribute to urinary problems.
So how do people get to you?
So in my opinion, I think it's best to consult with your medical provider. So typically it's a urologist, a urogynecologist, or your gynecologist to rule out any serious medical conditions. Make sure you don't have a urinary tract infection, and they'll do bladder testing to see if you're retaining urine and how the function of your bladder is working. My role is to look at the pelvic floor muscles and all those other things that go around. So getting medical workup from a physician and then requesting a prescription for physical therapy.
All right. So our time is up. I just want to thank you very much for educating us today. As always, there's always some back end work that gets done. So thank you to our team, Lauren and Suze, for helping us. Our next Spirit of Women event is on March 30th, related to colorectal screenings, entitled Protect Your Bottom Line. So look out for that. It's going to help us understand what we need to do to keep ourselves safe. We also have many others planned for you throughout the year. If you're interested, please go to inspiraspiritofwomen.org to register for those. In the meantime, stay safe, everyone. Continue to wear your masks, stay 6 feet apart, wash your hands frequently. Thank you for joining us today. And again, thank you, Tracy.
Thank you for listening, and thank you for the Spirit of Women for hosting this and inviting me to speak.